I'm very grateful that you're considering the Ruth Moore Act in this afternoon's legislative hearing, and I appreciate the opportunity just to talk a little bit more about this bill and why I desperately think it needs to become a law. The bill has been endorsed by every major VSO, including the American Legion and the Veterans of Foreign Wars. We appreciate their support and all the work that they do for veterans and their families. The Ruth Moore Act would relax the evidentiary standards for survivors of military sexual trauma who file claims for mental health conditions with the VA. Currently, MST survivors need further proof of the assault, which for many of them is impossible. Under this bill, in order to receive service-connected benefits, a veteran would need a statement that the assault took place, along with a diagnosis from a VA healthcare professional that links the assault to a mental condition. This bill also requires the VA to report MST-related claims information back to Congress. As members of Congress, we have a responsibility to ensure that the VA is providing timely and accurate decisions to veterans, but we can't do that without sufficient data. The bill is closely modeled after the 2010 change to VA regulations for combat veterans who have filed PTSD claims based on their military service. As I'm sure most of you know, the VA relaxed the evidentiary standards for veterans who suffer from combat-related PTSD. The VA finally acknowledged that far too many veterans who have deployed into harm's way suffered from service-related PTSD, but could not, through no fault of their own, locate military documentation that verified the traumatic events that triggered their PTSD. The VA now accepts their statement of traumatic events, along with a PTSD diagnosis and a medical link, as enough to receive disability benefits. So what we have is an inequity in the system, and those who were raped or harassed in the military have a much harder path to receiving benefits, even though injuries are service-connected and the same standards should apply. Ruth Moore, who Mike introduced earlier, who's here with her husband Butch and her daughter Samantha, is who this bill is named for. She is a U.S. Navy veteran from Maine who was raped twice during her military service. When she reported it, she was discharged and labeled as having a personality disorder. She spent 23 years fighting the VA to get benefits, and she battled homelessness and PTSD during that time. I am very proud of Ruth to be here with us today with her willingness to come forward and to help so many others in her own testimony, both before this committee and with the many people she's been willing to talk to about her story. Ruth, like many MST survivors, did not have the military records that corroborated the rape, so her claim was repeatedly denied. And unfortunately, she's not alone. DOD's own numbers indicate that over 85% of assaults go unreported. So I ask you, how are these veterans supposed to qualify for the help they need from the VA? The VA will tell you that the system accepts secondary markers as evidence to verify that these assaults occurred. And as comforting as that sounds, we have seen time and time again that the VA is inconsistent in applying those standards. What one regional office will accept as proof, another will deny. Almost every day, I hear from another survivor who has had their claim denied after these secondary markers were ignored. So I think it's a problem of fundamental fairness. If a medical diagnosis and link to a claimed event is enough for one group of veterans, it ought to be enough for another, especially when we know how hard it is for documentation to exist to support both instances of sexual assault or combat-related events. Critics of this bill might say that it's too easy and veterans can just say anything to get those benefits. First of all, that's just simply not true. There still needs to be a medical diagnosis and a medical link, which are not at all easy to come by. And secondly, we hear that the same argument when the VA proposed similar changes for combat veterans, and I haven't heard the VA say there were big problems with veterans lying about their service. The bottom line is that it's gone on for too long, and the burden of proof has been on the veteran. It needs to change now. Mr. Chair, over the last 2 years, I have heard from dozens and dozens of veterans from all over the country. Men and women who volunteered to serve, many of them planning on a career in the military, only to have their career cut short by the horror of a violent sexual assault. Whether the attack happened on a Navy base in Europe or a National Guard training facility here in the U.S., whether they were soldiers, sailors, airmen, Marines, the story too often has the same ending. The victims were blamed, the crime was covered up, and the survivors themselves become the subject of further harassment and recrimination. All too often what followed was years of mental health issues, lost jobs, substance abuse, and homelessness. But the stories don't have to end this way. with the Ruth Moore Act, we can change the VA's policy so that veterans who survive a sexual assault can at least get the benefits they deserve. Thank you very much for your time, and thank you for considering this bill.